Hello and welcome everyone to the first live talk by World of SLP. It's in live conversation with Mr. Pradip Kumar Lahiri, a renowned person in the field of laryngectomy rehabilitation. So before we hand over the mic to Mr. Pradip Kumar Lahiri, let's just get a brief idea about what is esophageal speech. It's basically for all the undergraduate students who are still in the process of learning. So it's a quick 10 minutes presentations where we are going to talk about the esophageal speech. Anil, everything is fine? Anil, all good?
Yes, ma'am. We can begin now.
Okay, so let's get started with esophageal speech. Today, we are not going to talk about the other options that are available post laryngectomy. Our presentation has to be short and crisp, focusing mainly on esophageal speech. So, as we all know that laryngeal cancer is one of the commonest cancer that occurs, and the rehabilitation post laryngeal cancer, I mean the treatment that happens is mostly laryngectomy, hemilaryngectomy, chordectomy, or any of these sort, leaves a long impact on the person's ability to communicate. Also, there are different implications that happen not just on communication but also on swallowing, on overall mental, emotional, financial life. But let's not forget that the first and foremost implication is that the person loses his ability to communicate. So we as a communication specialist should have our major role in rehabilitating these individuals. So these are some of the alternatives that so far we have used commonly, being the artificial larynx, esophageal speech, and the tracheoesophageal speech. All these approaches have their own advantages, disadvantages. But when we talk about these approaches, the one which is most, relatively very similar to a natural speech is the esophageal speech. And why exactly it is? Because in esophageal speech, you're using your own anatomy, your own physiology. Though the process is slightly difficult than any other process, but it is one of the most natural process. So the other options which are there in artificial larynx, you have the electrolarynx, you have the different type of electrolarynx depending on the placement. So you can either have it on the neck as shown in the figure or in the mouth. Tracheoesophageal speech, on the other hand, involves a surgery in which the mode of voice production is restored, but it involves a major surgery. I shall put up a video on the other methods also, but today let's just focus on esophageal speech. So esophageal speech, when we say, you have to understand that there is an altered anatomy of the person, and this altered anatomy is going to adapt to the physiology of speech production. So if you look at the two markings on the diagram, you will realize that the vocal fold, which originally were the basic source of voice production, are no longer present in a person post laryngectomy. So the function is now taken over by another segment which is very essential for producing esophageal speech, and that's the PE segment or the pharyngoesophageal segment. So this is the major difference in the anatomy involved in voice production. At the same time, if you look at the arrows, you will realize that in a normal person without any surgery involved, the air flow which is needed for speech production is from the nose as well as the mouth, and then there is a exhalation phase which mainly leads to voice production. But when you're looking at an esophageal speech, you realize that the voice production is definitely from the oral cavity, but the airflow is going from the stoma. So how beautifully these two systems are taken into consideration and then voice is produced is what we have to understand. So if I look at the process of esophageal speech, you'll realize that you have to swallow the air in the cervical esophagus. So in the diagram, I have shown that cervical esophagus is somewhere around C5 to C7 level of your esophagus. And then below them, there is thoracic and then abdominal. So you swallow air, which is a trick that you have to learn. It is the most trickiest part of the entire process. How exactly do you swallow air? And then you expel this swallowed air. When you're expelling this swallowed air, in the process, there is a vibration that's produced of the pharyngoesophageal segment, the pharyngeal mucosa, and thereby a sound which is produced, which is then shaped by your oral cavity by different articulator movement, and then you produce the speech. Very shortly put, but the process is really like, it's comprehensive looking right now, but it's something that needs mastery over the years. So once that air flow comes in the oral cavity, you move your articulators and then shape it into required speech. Now, the trickiest part is the swallowing of the air into the esophagus. Different methods are outlined in theory, that glossopharyngeal press method, in consonant injection method, inhalation method. I have focused on these two because injection and the inhalation method in literature also has been outlined that they are commonly used by individuals learning esophageal speech. So what exactly happens in injection method? There's a generation of the positive pressure in the oral cavity. So the tongue moves against the palate and the air is, trapped behind this, and then it is injected into the cervical esophagus. So basically, you are utilizing the positive pressure in your oral cavity relative to the laryngeal cavity. Sorry, not the laryngeal cavity, the airway, lung cavity. So there is negative pressure in the down part and the positive pressure in the oral cavity. So the movement of air is from the high pressure to low pressure, and then it is expelled out. Other hand, the inhalation method utilizes the negative pressure which normal anatomy also produces. So when we have to inhale, our lungs have to expand. So the volume increases, the pressure in the lung cavity goes down as compared to the atmospheric pressure. So that creates a pull of air from the atmosphere into the lung, and then we have to expel this air column that will be shaped into a speech. Very shortly put here, because just to get an idea before we get into conversation with sir, but definitely you need to know more about these methods in theory as well as practical. Having understood the process, you need to also know that there are many advantages of esophageal speech. Most common one, that it's hands free. There is no recurring cost involved as opposed to an artificial larynx. You do not require an additional surgery like the PES, tracheoesophageal speech, and it is, as compared to all three, it is the most naturally sounding speech, utilizing the patient's own anatomy and physiological structure, like how a normal person would produce a speech, and you are restoring a lifelong communication problem. So, when you are using an artificial larynx, if the device is not there, you are again voiceless and you just cannot communicate. But this is something you can never lose, because once you master the skill, you can communicate forever like a normal person. Also, there are drawbacks because the intensity of voice will be less, as the amount of airflow coming from your oral cavity, that is really less. So that is one problem. The utterances have to be short because you're utilizing the air that you are taking in from the oral cavity, and the fundamental frequency is somewhere around 65 hertz, which is relatively lower than what a normal fundamental frequency of a male or a female would be. The inflections, that is the pitch and the loudness variations, are produced very limited, and it requires training. Most often, even sir can highlight more on this topic, but people find it difficult in certain cases when they have a cricopharyngeal spasm, where the entire muscle goes into a spasm, and then they have to go for a surgery like myotomy, and then they can probably learn esophageal speech. And the second condition is when there is reflux esophagitis, which is another medical condition, which probably puts a halt on learning esophageal speech so competitively, while otherwise it would have been possible. Why we need to do this collaborative talk today with sir is that we have studied very well in the theory that we need to involve a laryngectomy person in the rehabilitation process, but by far and large in practical life, how often do we do this? This is important because we have to understand the practical application of this thing. It's really there, and sir will tell us exactly how and why their involvement is very, very important. As an SLP, we look forward that we have to help the person communicate. We also need to look at all the information. If it's not possible by me, I need to timely refer to a person, get their collaboration, and make sure that this person who has lost the voice and the communication ability is able to restore it back. So I think as an SLP, it's a very important area, because if we, being a communication therapist, cannot help someone just because of lack of certain skill or lack of that amount of dedication which that patient needs, we definitely need to look into this matter. And it's not just what we feel, it's also outlined in the literature. So there's a very recent article in 2019 emphasizing completely on rehabilitation for a laryngectomy is not just the role of SLP, but we need to be open enough to involve a rehabilitated laryngectomy patient, because it has really far-fetched effects. So wasting no more further time, let's just hear it from the guest for today, Mr. Pradip Kumar Lahiri. So over to you. Let me introduce Sir. So, Sir, thank you first of all for joining us. It's a talk that probably is really out of the box, but we really wanted to do it because people really need to know that how important it is to have you involved in the team while we are rehabilitating these individuals. So, welcome, Sir. Anil, would you like to just?
Uh,
Okay. So, sir, before we begin anything else, we really want everyone to know about your journey. So, right from the diagnosis to the surgery, sir, what has been your journey, sir?
Shall I start?
yes, sir.
Yes, sir.
Good morning to everybody. Medically, I am a dumb man. And it is surprised a dumb man how it is speaking. Anyway, 45 years back, I came to Bombay along with my family. I stayed in Mumbai, near Sikara colony, and now I have settled in Novi Mumbai along with my wife and children and their family. I was retired from a government organization, Department of Atomic Energy, in the year 2001. Since it is atomic energy, construction for that was very difficult. I was interested few international standard concept constructing buildings which would have to be utilized for radiation preventive measure. It is full of stress and tension. I started taking tea continuously, and continuously I used to smoke. It ranges from 30 to 40, and my working hours were 10 to 12 almost every day. During the course of time, I observed my voice is sinking. I came to know I am a cancer patient and my vocal system should be removed totally. Initially, I was scared, but I thought by sacrificing sound, if I can live, why not to do that? So one fine morning, my total system was removed. I became dumb and speechless.
Right.
Uh,
Anil.
yes. So, sir, like you rightly said, one second. So, sir, I wanted to highlight to all the SLPs out there, it's not just we are part of just the assessment and just the pre-laryngectomy and post-laryngectomy of the assessment management. We have to see the bigger picture here. So we need to address the prevention part also. We need to be, as a member of the allied healthcare, we should also be advocating for prevention of cancer and various other disorders that we are dealing with. So we should advocate a healthy lifestyle and away, like saying away from radiation, then no to smoking, alcohol, tobacco chewing, and also we should be advocating not just the assessment and management, we should be seeing the bigger picture here, and we should be focusing also on the prevention part of it. So, sir, with the follow-up, I wanted to ask you, post-surgery, you might have been given a lot of options for speech rehab, and how after post-laryngectomy, when the voice box is removed, what were the steps that were given to you?
First of all, Italy has explained theoretically in such a way, so practical application is not much valued there. However, actually, voice is the media of sharing ideas between two. I've lost that. I lost that advantage. Nothing was left. I was deserted, demoralized, and my interest was gone totally. I started going trauma life. However, life is not end here. Just now, we told there are quite a few options. That time, during my time, 30 years back, TV was not much uh, well known. Only electrolytics was to be done. I started my vocalization with electrolytics, but I found, of course, it was cost about 70 to 80,000 30 years back. Starbucks, Germany made. It was given by my department. But this is one disadvantage. Second, when I heard it was a robotic sound, I heard people are not hearing me. They are just observing one robot. I lost interest. I rejected it. I heard that just now with a little by swallowing, they are injecting air in the esophagus for food pipe. I may be possible to talk. So I started, unfortunately, 28, 30 years back, there was not such an institution. A laryngectomy can take the training, neither in India nor in abroad. I told you inject air and try. I started day and night without any break, with a firm confidence and determination. I will talk or I will not exist. I will not be like a sick man. One time morning, I suddenly heard my sound. It energized. I started speaking. However, after 1.5 months, at least with the help of injection method, I started speaking. That practical speaking, I can show. I started my voice.
Yes. Yes. So, sir, you use the injection method. So, a trivia question for all the SLPs out there. Apart from in esophageal speech, apart from the injection method, what are the other methods that are available for esophageal speech? Do write that down in the comment section. So, sir, I know you told us like learning esophageal speech was like a long process, and it took a lot of hard work. And sir, after cancer and the other emotional aspect related to it also. Sir, I wanted to ask, sir, since it was such a long process, and how did you stay motivated? And like, how did like proper training of esophageal speech for you begin?
You are absolutely right. That is a very good question. I might have motivated myself, but 99.9% laryngectomy, they are not motivated to take this trouble. Even neither purchasing of electrolytics year after year is possible for them. Not TP was not. So alternating this process, continuous motivation was necessary. Until unless you motivate the patient and their caregiver, they will not be able to, their negative idea will not go. So motivation is a basic thing of starting esophageal speech. And that I have thought of motivating certain process. That was the root.
Yes.
True.
So, sir has been trained in esophageal speech. Sir has been trained in esophageal speech by the government of Japan. Sir has undergone a 3-month training for esophageal speech. Sir has also like played a key role in like establishing the laryngectomy section in the CRC Prince Ali Khan Hospital, along with Miss Anita Veswala. She yes. Yes, sir. So you want to tell a little about that?
We must think about Dr. Sultan Pradhan. He is the only oncologist thought about us. That we
Yes.
should.
And sir, so like you have been volunteering and working with persons with laryngectomy for a long time. It has been 22 years now. You have been working with persons with laryngectomy. Sir, any message that you have for the cancer patients, the person with laryngectomy?
First of all, each and every laryngectomy patient should have idea that I should be motivated myself, and I have to determination and strong willpower is the keystone key of esophageal speech, for which we'll have to motivate quite a few days patients, and we can show in our small group what we have observed. A patient when comes with a negative thought, what he observes, somebody is talking like a normal man,
Right.
somebody is getting training, somebody is already started speaking,
True.
and people are very much in a family type environment. They themselves are motivated. They at their own, they say, we want to learn.
Right, sir. Right. So, sir, rightly, if I want to sum up the answer, I would say that the normal thing, even when other conditions we face, sir, the moment a patient comes with some pathology, they first ask us कि ऐसी तकलीफ वाले ठीक होते हैं क्या, बात करते हैं क्या? This, if I show a person and the person himself says that, see, I had gone through this and today I'm communicating, I mean, it's nothing better than that. So you are the perfect role model we feel that every SLP should have, because a person, no matter what speech therapy I give, if he's low on motivation, I can't bring him to the level where I have my vocal folds no matter what I say. But if a person who has been through this journey and is talking so well, like nothing like that. So I think it's the best point here. And as Anil said, sir, that you have been training, like this center where you are there, sir, it's doing a phenomenal job. So, sir, how many people have you trained so far, sir?
We are the only organization in India. I do not know what abroad esophageal speech except Tokyo. So, with our limited resource,
Yes.
we have been able to get the boys back, and many of them have estimated about 4,000 to 5,000 minimum.
Oh, okay.
And out of am very much there, lakhs and lakhs people are leading new life.
Yes, sir,
So,
absolutely. So, sir, if one organization can do like around 4 to 5,000, sir, if there are more such organization, we wonder that I don't think any laryngectomy person should be mute for lifetime. Correct.
and unfortunately, there is no awareness. Government is not encouraged. Even, I'm sorry to say, the person surgeon who is taking surgery is also not motivating the people go there.
Exactly. Okay, so this is, if you say there's a 4 to 5,000 one center has done, I mean, you have given a mode of
20
communication
years, 20
time.
years,
Since
20 years.
22, yes, sir. It's a long time we see, but the dedication, like stretching
Because
it for 22 years, involves a lot of dedication.
why? Because our session, a person can talk minimum requirement of time is 6 to 60 weeks.
Oh, okay. True. It was
Everybody cannot learn with them. It is very difficult.
right, sir. Right.
But maximum advantage in our country, it is free of cost.
True.
And it is your voice.
Right.
I am proud. I have created voice.
Exactly, sir. There can be no better feeling than getting our voice back once we have been mute. And as you rightly said, sir, if looking at the India's socio-economic status, we don't know, sir, how many can afford a artificial larynx.
They cannot. You know the problem of electrolytics. That
Right,
also can do. We know the problem.
right, sir. So exactly, sir. And sir, if you're training a person who has to go for esophageal training, I know it's highly dependent on person to person, but on an average, sir, how long do you think a person takes to at least get used to esophageal speech? Not a proficient speaker, but basic training.
Out of 1 or 2%, within 2 to 3 weeks, 2 3
Oh,
sessions, they pick up. But generally, 7 to 8 weeks are required.
okay.
Besides, there is another problem we have already explained. That is medical problem.
Right,
Yeah,
right.
this speech may not be necessary. We recommend for electrolytics. Even we know that if it is gone, you will be again speechless.
Right.
And we are handling a lot of TB cases which comes from Tata Memorial Hospital.
Okay.
Problem is their voice is much better than us. Limited period, 6 months, 9 months, 1 year. Can a person every recurring spends 40,000-50,000?
Right, sir.
Sir
True.
rightly said ki, like it is not just ki why speech rehab is important because it helps them reinstate them into their real in their normal life. Like like the cancer is gone, the voice they have their ability to produce voice is gone, but speech rehab helps them to like reinstate them into their normal life. So sir, my next question to you is ki, do you have idea of any certification course that are available for SLPs or like for training people with esophageal speech?
We have got a lot of institutions, NIAR, Tata Memorial Center, Prince Ali Khan Hospital, but practically speaking, to learn esophageal skill, to hear is to SPL. According to me, nowhere it is available. Moreover, we can show, we can, SPL can develop a process of speech, but we cannot issue a certificate. We are not authorized.
True.
I can train you, but I cannot give you certificate.
Right,
You are
sir.
yesterday you did. You cannot continue.
Right. So, sir, there is a need to have such organizations where a laryngectomy person, in collaboration with an SLP, can bring about some changes. Like because, as you said, sir, there are no much centers available.
But
Even if
nothing,
there are
nowhere.
nowhere it is. It's a
I am
highly
telling
neglected thing.
I
Yes,
have been to New York, like England, everywhere. People are either TB and electrolytics, and that is very cheap for them. They are not interested for this. So nowhere it has been good. But
true,
particularly
true.
our country, 90% are poor community.
Right, sir. Indian community, sir, I think it's a very good option because rather than leaving them without a voice, if there are enough centers, they can definitely go and get trained. And so you even mentioned about the organization that you're working, which has done so much like phenomenal work. Can you tell us a little about how this organization started and who are the key members?
I am keen to tell about this.
Sure, sir. Sure.
An organization cannot be run by a single man.
True.
So when I joined there, in that respect, I will show my regard to Dr. Sultan Pradhan and Mrs. Anaita Besola. They have encouraged me to build a good team. 1 year it took to make some good survivors who were dedicated. I trained them how to speak. I trained them how to train others. And 4 people out of that, one is lady, 74 years old. They are master in delivering speech. It's, we have got a lot of other works, counseling, supplying, providing accessories, medical well, rationing for the poor people, recording. There are few qualified, well-educated ladies and some gentlemen who are interested to join us. And our team only gives training to the patient and they look up all the other ones. And moreover, Anaita Besola is advising as and when, whatever we require.
Understood, sir. Anil, next question.
Yes. So like from my personal experience, I can say Gisar is a very enthusiastic and a very energetic and motivated person. Because like we had a talk with sir like 2-3 days back. Sir was like, "Ki Anil, I know ki I just graduated." So sir said ki I know ki when things normalize, come to CRC, Prince Ali Khan Hospital, see how we work. So I was like very inspired by sir. So sir, like for the SLP community, like what are your like what do you give any suggestions or how for SLP community that you have?
It's a very good question for particularly SLP. I am telling you, first of all, if you want to train very laryngectomy, don't take it professional way. Let it be some social responsibility. This is first. Second is you have to train yourself for clinician like us, where we may not be knowing theoretical part, but practical application is much necessary. And you can see there how people are motivated, how we are carrying out counseling work. That are all the things you can set up. And then at least every SLP should attach with a laryngectomy dedicated. You do everything. Practical application, you will do. That is my inner feeling. That without laryngectomy, SLP will not be able to train or learn esophageal.
Right, sir. Right.
You understand?
Yes, sir, completely, sir. So what you say, sir, it cannot be overemphasized that though SLP, I might know the entire theory part, but the practical aspect, even if I want to, I remember, sir, you training me also during my internship, like I wouldn't have learned it, sir.
I am a layman. I am uneducated. I have told you.
Yes. Ma'am, I like there is a question, sir. Ki, like for like if we are training how to produce esophageal speech, like our anatomy now, as we don't have the anatomy, like the right anatomy to produce esophageal speech, correct?
Correct.
Yes. So, sir, so for that, like to show a real example how a esophageal speech sounds like, we definitely need a person with laryngectomy to demonstrate to the person how esophageal speech sounds like, and we can work in a team and provide a better speech rehabilitation for person with laryngectomy.
And for other part, you should come to us. I don't know. I find our organization where you can train yourself how to motivate, how to counsel, and what are the environment you have to make.
Sir, if it would be wonderful, sir, if you could show a a little part about how do we start the training, sir. If you could demonstrate a bit of it.
I am showing the practical demonstration.
Yes.
Okay. You have told that you'll have to take air into the food pipe,
Yes.
can exhale it.
Yes.
It is very, very difficult. I am giving you an example because people run away. Then I'll show you. Shall I take a white water? Because a new patient do not know how to swallow air.
Yes.
But if you put a drop of water, you'll have to drink. Water will go. This is nothing. This is our Japanese method. They take green tea. What is the method I am doing? I am exhaling air. I give a body pressure. That should not be any body pressure.
Okay.
You have to be stomach squeezing when you exhale like that. Sound has come.
Yes, yes.
This is the basic thing. With that belching, you can make sound and articulate your lips, tongue, etc. And we can talk like just one belching is changed to a syllable. Make it longer with one breath, one sound, one breath, two sound, one breath, five sound, like that. Then combine you will. Then later one word, kulaba, Italy on it. I am on it. Like that, step by step.
It is amazing, sir. We couldn't produce a belch. A single production of a belch is so tough. It's wonderful, sir, how you are just combining. And I wish, sir, all the laryngectomy patients who are undergoing a surgery and feeling so demotivated should meet at least one Pradip Kumar Lahiri in their life and learn about this technique. It's phenomenal, sir.
I'm a very simple and ordinary man.
But so you're doing a phenomenal job, sir, and that is what even it's not for.
That was my passion. That I feel the pain of a laryngectomy, and I think if I can speak, I not make somebody to speak.
It is a motivation, sir. We feel that every SLP should have the kind of connect that you have made, and that is the reason that you're doing so good. And we really look forward, sir, that more and more such patients get help from you, and hopefully, sir, the Indian scenario will change where a laryngectomy and an SLP would combine. Some any concluding remarks, sir, for the day and for the
don't laugh at me. I am proud I had cancer. You have followed.
Yes.
I am proud I had cancer one day. Why? Otherwise, I would have been a normal, ordinary man.
Yes.
Now, people from India and abroad, no. Second, cancer is not the cancellation of life. Provided somebody should go to the proper place, take proper treatment, and with the proper doctor, then the first stage itself, sometimes you can save your larynx also. And like one grievance is there. Only we are doing. Why we are not supported by government, by medical professionals, another. Awareness is not necessary, which is not there.
Absolutely, sir. And it's such a noble thing. At the same time, it's so important. We wish, sir, that we could bring up change in this scenario, because what you said is right. Like the motivation level that I can understand it. You're saying that you're happy that you had cancer. That is the reason you've emerged so different in your life, and we completely agree with that, sir. It was wonderful, sir, having you here, listening to your thoughts. And today I understand that what the line in Pratter and Swift that I've studied, it is really practically very important, sir. That it's not just to listen that, okay, laryngectomy should be there, but it's very, very important, sir. I think Anil would agree completely on that.
Yes, ma'am, definitely. Ma'am, there are some questions coming on the YouTube live also. I'm sorry, I'm juggling like in 2, 3 places. So I'm really sorry if I'm not able to answer some of the questions there in the chat box till now. So,
Mm-hmm.
ma'am, people are asking about the rehabilitation center name sir is working in. So we have like mentioned it already that sir has been working at CRC Prince Ali Khan Hospital. Along with that, sir goes once a week at Tata Memorial Hospital also, where sir is a volunteer for esophageal. Yes.
Any other question?
Sir, apart from that, I'm just reading out. I'll read out the questions. Okay. We don't have a lot of questions here in the chat section, so we will. I think, ma'am, we can wind it up because there are not a lot of questions there in the chat section.
Yeah. So my concluding speech is thank you very much, Italy and Anil, to give me this opportunity to talk. And I think worldwide, this is the first session that we have been able to tell about some esophageal speech theoretically and as well as practical application. Thank you very much. Thank you to all who are participating.
Thank you so much, sir. Thank you so much for being a part of this. It was really enlightening, sir. And we are grateful that, you gave your time and your, wise thoughts, sir. Thank you so much, sir. So a take home message for everyone who has attended our talk today. Definitely a laryngectomy patient does not just require therapy, he requires many more things, especially to maintain that motivation to attend the therapy. And I
Right.
think the best person to give that motivation is not us, because we have not been in their shoe. Someone who has been in their shoe and is there standing in front of them would be the best thing. So do involve one of our rehabilitated laryngectomy in your team. Secondly, make sure that you are looking a person as a whole. Artificial larynx, TEP, and all these are options we have studied. But when you look down practically at these things, it's really different. So if you are into this field, make sure you give the right amount of option available to all your patients. Thank you so much, sir, once again for joining us. Thank you.
Thank you so much.
Goodbye.
Thank you, everyone, for attending. Thank you, everyone.